I just want to say to you guys, congrats on making it to final year. I know we haven't had a session in a while. So congrats on that, everybody. And I'm really proud that everyone made it this far. All right. Um, so the aim of these sessions is to ensure that everybody passes. That's the first and foremost aim. After that, we can take it up a notch and ensure that the grades are, on like an honors level or whatever the case is. But the reviews, first and foremost, the objective is to make sure everyone is passing, right? What we're gonna do is primarily go through a lot of questions, and I'm gonna teach all the teaching points that we can get from the questions. That's gonna be the primary aim. And the second aim is gonna be to give you guys like some kind of homework or assignments. I'll give them at the end of each class, and I'll allow everybody to probably upload it on a Google Drive, and then I'll either mark it or I'll post some form of answer sheet for you guys to mark them. This different spin on this, however, is each question that I give you guys as an assignment, I'm going to actually break it down into a system as well as whether it falls into medicine, obs, surgery, whatever the case is. So for example, if it's a medicine question, I'll also put a tag that it's medicine, but it falls under the respiratory system. The reason I'm going to do that is because as you guys do these assignments, and whether I mark them or you mark them yourself, whatever the case is, I'm going to create like a little sheet for you guys to tick whether you got something wrong in whichever system and all of that jazz. When you guys do that, you'll have an idea closer to exam what systems you're probably weak in and what you can brush up on, right? So I'm going to try and get that rolling as well. And the next thing is, I know the exam format is changed. So as we're going through these questions, what you're going to find is it's not going to be the case where we're doing only medicine or we're focusing on only obs for a particular session. It's going to be mixed because I want you guys to have that frame of mind that, okay, we don't know how the exam is going to look. We don't know if it's strictly obs, strictly medicine. So the question could be an obs one, it could be a medicine one. That's how we're approaching the sessions, right? So each session, you're going to get a full exposure of each subject area. So that's what we're doing there. The next thing is, if they do decide to switch back the format to medicine only, obs only, then I'll switch back the way we do the sessions to focus more on that, right? So I'm just giving you guys some reassurance there. If anybody has any questions so far, let me know before we start, all right? All right. I'm assuming everybody's good. Okay, great. So as we're going through these questions, right, in any MBBS exam, because it's a standardized exam and it's created for the region, you're going to find that the questions are going to have 3 layers of difficulty, right? So I'm going through the basics, guys, starting, right? So you have 3 layers of difficulty with these MBBS questions. So you have something called a first order, and you have something called a second order. Okay, all right, cool. So you have a first order question, a second order question, and a third order question. That's how the exam is going to look. As we're going through these questions, I'll point out so you guys can have an idea of what each of them are, right? But generally, as you're doing the MBBS paper, with any standardized exam, the goal is to ensure that you, the student, is able to pass the exam, right? So you're going to have a lot of first order questions. So your first order questions are going to be straightforward questions that you don't have to do any form of thinking. It's just, do you know it or do you not know it, right? So an example of a first order question, I know I'm putting something basic, but it's going to be like something like, what is normal blood pressure? That's a first order question, right? Just something basic, something straightforward, if you know it or you don't know it. So if we see questions like these as we're going through the review sessions, chances are there's not much to explain. So I'm just going to give you the basic factoid for those questions, and then we'll move on, right? Now, a second order question, it's testing application of knowledge, right? So what I mean by second order, someone has a question? Nope. Okay. All right, cool. So what I mean by second order question is it's going to take you some amount of reasoning to get an answer. Meaning, for example, they might give you a scenario of a patient, and then you have to make one step first, which is probably reading the stem, getting the diagnosis, and then answering the question because you know the diagnosis, right? So it's like a two-tier question. So it's testing, it's actually two questions packed into one. And then a third order question is a question that has like three questions packed into one. So it needs you to like unravel three different steps before you get to the answer. And that's the general level of difficulties that we'll encounter as we're going through these MBBS questions, right? So that's that. And we're going to continue. But before we do, the next thing I want to point out is when you do your MBBS exam, if it is hard, there's a bell curve. So they actually curve your MBBS exam score. So if it's a super hard paper, then they can lower the pass mark to accommodate a certain percentage of people. So always bear that in mind as you're doing your exam. So if everyone found the exam super hard, super unfair, then they can lower the pass mark. The next thing is if a question is poorly written, then when they're reviewing it at the end of you doing the exam, they can throw out the question. So just some general stuff to bear in mind. So if everybody find a question kind of ridiculous, don't panic about it. It's probably going to be thrown out if there was a ridiculous answer or there are no answers, right? All right, cool. So we can start the session. I'm not going to keep you guys super long since it's the first one and we're just kicking off, right? So I want you guys to be interactive. So I'm going to ask you to like pop up the chat, and I want you guys to attempt the question before we actually break it down and go through, right? So attempt it, even if you have to put the wrong answer, at least just have an answer in your mind so you can see if you're getting stuff correct. So I'm going to read the question, and then I'm going to give you guys some time to skim through the answer options. Then we're going to go through it, right? So let's look at the first question. And the first question says, there's a 45-year-old female who presents with a history of recurrent ureteric calculi. Her biochemistry reveals a hypercalcemia, hyperchloremia, and hypophosphatemia. Her alkaline phosphatase and serum parathyroid hormone are also elevated. And then the question asks, what's the most likely diagnosis? So give it a shot. Type it in the chat what you guys think the answer is. Just guess if you don't know, but try and make an attempt. I'm giving you guys like probably 40 seconds or less. All right, cool. So I'm seeing a lot of these, and well, I saw another answer as well, so we're gonna go through it, right? So the first thing is this is a surgery question, right? Initially, you guys never knew what it was, but yeah, it's a surgery question, and it's testing your knowledge on endocrine and renal, right? So this question is an example of a third order question, and I'm going to break it down for you guys. So as you read the stem, I want you guys to first, as you're approaching exam style tactics, first read the last sentence, right? So it says the most likely diagnosis. Skim through the answers. Don't actually read it. Just look. You see hyperparathyroidism. You're like, okay, it's asking me something along that line. So that's how you should start a question when it's a long stem or it looks a bit wordy. Start with the last sentence, read the answer options. Then the next thing you should do is start reading the rest of the stem, right? To get answer. So it says it's a 45-year-old female with recurrent ureteric calculi. So that means patient is having some kidney stones, right? So that's basically just kidney stones. So I have recurrent ureteric calculi, and the person has high calcium in the blood, high chloride in the blood, low phosphorus, right? And the ALP and the PTH is elevated. So look back on the question options, right? The answers. And we're seeing secondary hyperparathyroidism, tertiary hypoparathyroidism, primary hyperparathyroidism, etc. What we're going to do to answer this question is we should first have an understanding of the pathophysiology of, how PTH works. So you have a gland called the parathyroid gland, right? It's situated behind the thyroid gland, and it produces something called PTH, which is parathyroid hormone, which is that, thing they're asking about in the answer options. This is very important, right? Just having an understanding of how PTH works, very important. It's going to get you guys a lot of questions correct. So let's take some time, understand the foundation, right? So for the parathyroid to secrete PTH, you need to have a low amount of calcium in the serum. So it's always regulating calcium levels, essentially. When there's a slight decrease in the normal level of calcium, parathyroid gland secretes parathyroid hormone. PTH has several functions, right? It first works on the bone. When it goes to the bone, it actually targets the osteoclasts, which are those cells that kind of cut up the bone and allow for there to be more calcium, right? So it increases bone resorption, which just means, taking up bone or destroying bone to increase calcium, because bone is made up of calcium, right? So that's how it increases the calcium levels. And then PTH goes to the kidney. Very important that you guys know, when PTH goes to the kidney, it actually increases or activates vitamin D. That's the big word you see here, which is 125 dihydroxycholecalciferol. It activates vitamin D. Vitamin D has a function on the kidneys, which is to increase calcium and increase phosphate. I'm hoping everybody's following. If you're not following so far, type in the chat. So that's the function of vitamin D, which is also very important. The next thing is the PTH. It goes to the kidney, specifically at the distal convoluted tubule, and it will cause an increase in calcium reabsorption, right? So by increasing the calcium, it normalizes the calcium levels. Follow? And then also, at the same time, while it's increasing calcium reabsorption, it also causes phosphate to be excreted, right? So that's the function of PTH. Now, what I want you guys to pay attention to is, if you notice here, where we have activated vitamin D, we mentioned that activated vitamin D increases phosphate absorption in the intestines, right? But then we're also seeing that PTH over here causes phosphate to be excreted. When you compare the two, the excretion of phosphate by the kidney, it's more potent than the reabsorption of phosphate at the intestines. So when we go up back on the question stem here, going up, so if we go up on the question stem and we look, and we're observing the values of the labs, I'm just breaking down everything. We see here hypercalcemia, right? So we know that, okay, this increased PTH here it caused an increase in calcium, as we saw earlier. And then the next thing is, remember I mentioned that PTH, it has a greater effect on the excrete phosphate, right? Compared to the absorption of phosphate, which is why we have low phosphate here. I'm assuming everybody is following. And then lastly, if you guys remember, I mentioned that PTH also causes bone reabsorption, meaning cutting up of the bones. This particular enzyme here, alkaline phosphatase, is usually increased whenever you have any form of bone damage. It's also increased if you have any form of liver problems. It can increase as well sometimes. But primarily think about ALP or alkaline phosphatase as being related to bone. So anytime you have bone damage, whether it's a fracture or anything along those lines, you get an increase in ALP. So that's why I'll have increased ALP here. So right off the bat, we'll have an idea that, okay, this particular question, it's referencing some form of hyperparathyroidism, right? So we can rule out option C, which said hypoparathyroidism. It's definitely not that. We know it's something hyper-related, right? Now, the next thing that we can cross off the list is quaternary hyperparathyroidism. That's not actually a diagnosis per se. It's not a recognized one. So I don't know why you in particular put that. It's not fully recognized as yet. So focus primarily on primary, secondary, and tertiary, right? So we're left with three options. Now, what we need to do is understand what's meant by the term primary, what's meant by the term secondary, and what's meant by the term tertiary, right? In any form of pathologies that we talk about in medicine, when you're referencing a particular organ, primary usually relates to the organ. So if you say you have a primary hyperparathyroidism, it means the problem is related to the organ, right? If you say secondary hyperparathyroidism, it means the problem is unrelated to the organ, meaning the problem is not the organ, it's somewhere else in the body, right? So it could be another organ, but it's not that organ, right? And then tertiary just means doesn't fit the criteria for primary or secondary, all right? So I'm going to go through each of these because it's very important and it pops up in a lot of questions later on. So just to have an understanding, we know what primary is, we know what secondary is, we know what tertiary is, right? As in just the terms. So now I'm going to break it down for you, right? So when we talk about primary hyperparathyroidism, which is this one right here, right? Primary hyperparathyroidism. So focusing on that. That's specifically focusing on the parathyroid gland itself. It's telling us that, okay, the problem is the parathyroid gland, right? Now, what usually happens here is you have a hypertrophy, or it could be cancer, right, of the parathyroid gland. Whenever the parathyroid gland enlarges, it means it's producing more hormones. Follow me? If it produces more PTH, then we can understand that, okay, you're going to have all of these effects. Follow me? So we'll understand why the majority went for D. But let's look at A because someone also had A as an option, right? So let's look at why A is the answer or why A is not the answer. So here we have it. We're going to do a little bit of physiology, which is very important. It pops up later as we go through more questions, right? So I want to talk about secondary hyperparathyroidism. We're saying it's something unrelated to the parathyroid gland. So let me give you an example of a secondary hyperparathyroidism, right? And follow me because this also explains tertiary. So let's say we have a patient that has chronic kidney disease, right? Patient has chronic kidney disease. If you guys remember further down, earlier I mentioned that the kidneys have a role in activating vitamin D, right? So if you have chronic kidney disease, vitamin D cannot be activated. That's the first problem, right? So you can't activate vitamin D because kidneys aren't functioning properly. If you can't activate vitamin D, remember vitamin D's role on the intestines. Can someone just type it in the chat real quick? What does vitamin D do when it goes to the intestines? What's its function? Anybody? All right. So exactly. So vitamin D's function on the intestines is to increase calcium reabsorption as well as phosphate reabsorption, right? But if you can't activate vitamin D, you end up with decreased calcium. Follow? And then if you look on the diagram down below, parathyroid glands, they respond to low calcium. Follow me? So if you have low calcium because the kidneys can't activate vitamin D, you're going to end up with increased activity of the parathyroid gland. When the parathyroid gland's activity increases, the gland enlarges, right? So let me shift this down one sec. All right, good. Oops. Okay, there we go. So when the parathyroid gland's activity increases, it's gonna get larger, and that's how you get secondary hyperparathyroidism. But now, if you look on the stem itself, it never mentioned that the patient had any form of kidney-related pathology, right? So the answer can't be A, it can't be secondary, and we already ruled out C, and we already ruled out E. So we're left between B and D, right? So if we look a bit on tertiary now, which is also important. Tertiary, remember we said tertiary is unrelated to secondary, unrelated to primary, or it doesn't fall into one of the categories. What tertiary is actually just how I like to think about it is it's a further problem caused by secondary hyperparathyroidism. And I'm going to paint the picture. So let's say you had a patient with CKD, meaning chronic kidney disease. When a patient has CKD, their kidneys aren't functioning. We went through all of that. The parathyroid gland gets large, right? When the parathyroid gland gets large, it's producing a lot of PTH. Now, what happens with tertiary hyperparathyroidism is where patient had CKD, but then they had renal transplant, right? When the patient gets a renal transplant, the kidneys are functioning fine. So they get a renal transplant, kidneys are functioning fine, but the problem is the parathyroid gland still large. So because the parathyroid gland is still large, because it was compensating for the initial kidney failure, you end up with increased PTH. So that's where you get tertiary hyperparathyroidism. So just to recap, primary hyperparathyroidism, parathyroid gland large, and it's because of the parathyroid gland only. Secondary, it's because the parathyroid got enlarged because of a kidney problem. Tertiary is where you fix the kidney problem, but the parathyroid gland is still large and it produces a lot of PTH. So the answer here also cannot be B. So the answer has to be D, as in dog. So answer for this first question, dog, right? And this question is an example of a third order question because it requires a lot of reasoning. And then the last thing, just to mention, the patient had a history of recurrent urethric calculi. That's because they're constantly reabsorbing calcium and they have excess calcium in the kidneys being filtered. So you end up getting renal stones, right? So that's the end for this question. And we're going to move on. Anyone has any questions so far? Type it in the chat.